الله الرحمن الرحيم والصلاة والسلام على أشرف المرسلين سيدنا محمد وعلى آله وصحبه أجمعين دمان داودياشا قيمها إيا قايها له نغا داوانيا تلفزيونكا كالسن تي في waxaan idinka salaameynaa stuudiyihiisa weyn gudihiisa ku yaala aqalka Crown House magaalada London. maanta oo ahad ah sidii aan nooga barateen waxaan idin soo gudbinaynaa waqtiyadan oo kalena idin soo gudbin jirnay barnaamijka caafimaadka waxaa caawada marti inoogu ah dhakhtarka weyn ee ku takhasusay cudurrada haweenka oo la yiraahdo Dr. Ahmed Ismail. Dr. Ahmed Ismail oo intiina badan aqoon aad u leedihiin waxa uu yahay khabiir ku takhasusay cudurrada haweenka lehna gacantana ku haya maamulkiisa clinic weyn oo la yiraahdo Queen's Clinic ee ku yaala bartamaha magaalada London. dhakhtarku caawada waxa uu ka hadlayaa arrimaha ay ka mid ka yihiin recurrent miscarriageska iyo menopause. marka hore waxaan jecelnahay inaad si degan ula socotaan barnaamijka oo ujeedadiisu tahay in dadka yaga aan ku wacyigelino arrimaha markaasi muhiimka ah sida arrimaha caafimaadka. Recurrent miscarriage waxa weeye ilmaha dhicisoobaya ee soo laabanaya mar kaliya aan ahayn dhowr jeer haweeneyda uurka lehi ay ilmuhu ka halaabayaan. Menopause-kuna waxa weeye dhalmada oo joogsanaysa gebi ahaanba oo haweentii markaasi aynan mar dambe aynan keenaynin caado. marka hore dhakhtarkan ku soo dhaweynaya barnaamijkana wuxuu ku baxi doonaa luqadda Ingiriisiga ayadoo ay dhinac socoto tarjumaad af Soomaaliya. Dr. Ahmed Ismail, welcome again to Kalsan TV.
Welcome to you. Assalamu alaikum wa rahmatullahi wa barakatuh. I'd like to extend my good wishes. Eid Mubarak. We are in the most important timing of the whole year with the holy period, and tomorrow is the day of everybody celebrating the Eid al-Adha. In this occasions, we are going to talk about an important issue which was concerning me over the years, seeing a lot of Somali patients from the 80s onwards. I have noticed that there is three areas of great deal of interests. The first one is the infertility, which is meaning the people are unable to have a child. The second one is the recurrent miscarriage, mean women get pregnant and keep losing their pregnancy. And the third one is menopause. And the menopause is three areas: natural menopause and normal timing, early menopause, and that means women have their menopause between age of 40 to age of 45, and premature menopause, any timing of menopause before age of 40. And the word menopause means that the ovary stop functioning, not the period only. Must be the ovary stop functioning.
walaalayaal sida aad maqlaysaan dhakhtarku iyo anigaba waxaan jecelnahay inaan idin raaxo Eid Mubarak. waa maalin muhiim ah. barnaamijka waxa uu kaga hadlayaa infertility-ga, recurrent miscarriage-ka iyo menopause. Recurrent miscarriage-ku waxa uu yahay dhicinta oo soo noqnoqonaysa. Menopause-kuna waa macnaha dhabtii haweenta oo ay joojinaysa in ayba uur yeelato caadada oo ayaduna ka suulaysa haweeneyda. dhakhtarku intaa barnaamijka u gudagelin waxa uu yaro taabtay menopauska waxa uuna yidhi mid waa dabiici midna waa soo degdegaa oo waa macnaha dhalmadii oo joogsanaysa waqti xoogaa yaro horeeya oo haweeneydu ay ku jirto intaa u dhaxaysa 42 ilaa 45 sannadood waxaa jira mid premature oo macnaha kaaba ka sii daran oo ah waqti kasta oo ka horeeya 40 sano haddii haweeneydu ay gasho ay joojiso dhalmada amba ay qaadi weyso uur ay qaadi weyso 40 sano ka hor markaa waxaa la yidhaahdaa waa premature menopause marka hore waxaan gelaynaa oo aan ka hadlaynaa recurrent miscarriages. It is heartbreaking, Dr. Ahmed, to miscarry one baby after another. A woman faces a big difficulties when she loses a baby one after another. Each pregnancy brings both hope and anxiety, and each loss is unbearable.
Sure.
Means when a woman loses her pregnancy, she is not only strained, but a strain is put on the relationship between herself and her partner or husband. The strain is normally put on the strongest and the most successful relationships. So we know that this is very, very difficult and very challenging period. We would like to understand what is recurrent miscarriage and what are the risk factors of these miscarriages.
Right.
Thank you.
The word recurrent miscarriage means a woman who has had 3 consecutive miscarriage,
Yeah.
i.e. minimum of 3.
Mm-hmm.
The miscarriages will be, by definition, is loss of pregnancy before 24 weeks gestation,
Mm-hmm.
i.e. before 24 weeks pregnancy.
Mm-hmm.
Could be in the first part of the pregnancy called first trimester,
Mm-hmm.
which is from 0 to 12 weeks,
Mm-hmm.
and second trimester, which is between 12 weeks to 24 weeks.
Mm-hmm.
The reasons of miscarriage is variable between the early pregnancy and the late pregnancy.
Mm-hmm.
Most likely, the early pregnancy, the causes of miscarriages is completely different than after 12 weeks. That's for the people to understand that when they go and have miscarriages after 12 weeks, relatively easier to treat than women who has miscarriages before 12 weeks. What is the meaning of that? The meaning is, by definition, most of the miscarriages before 12 weeks are due to congenital abnormalities.
Before the 12 weeks.
Yes,
The early miscarriages.
that's right.
Yes.
After 12 weeks, most of the miscarriages due to the defect within the uterus or the cervix. Majority of them are the cervix.
If you repeat for us, you said women, the loss of baby pregnancies before the 12 weeks, before the 24 weeks or the first trimester. The first trimester is 0 to 12 weeks.
Yes,
So this is the early loss.
that's right.
And after that, we have a loss that occurs between the 12 to 24 weeks of the pregnancy.
That's correct.
And this is the second trimester.
Exactly.
You mentioned that the first, which one is more severe?
The
first-
more, not severe, both are severe.
Yes, yes.
Both is loss of pregnancy. But what is the most difficult to treat and to maintain baby and to get the baby surviving until the delivery is when the patient is less than 12 weeks is difficult, after 12 weeks is easier.
Okay, sida aad maqlaysaan dhakhtarka waxa uu ka hadlay macnaha caruurta dhicisoobaysa amba miscarriage-ka dhicinta soo laalaabanaysa waxa uu yiri waxa dhaca midna waa early oo waqti hore ayay dhacdaa waxayna tahay first trimester-ka waxa la yiraahdaa laga bilaabo marka haweeneydu ay caadada joojiso oo macnaha iska weysa caadada ilaa 12 week kaasi ayaa wuxuu yahay midka early miscarriage-ka waxa jira waqti labaad oo haweeneydu ilmuhu ay ka soo dilmaan oo ah inta u dhaxaysa 12 week ilaa 24 loona yaqaano second trimester-ka waxa uu leeyahay sababuhu waa variable waa sababaha ay u soo dhacayaan waxani u dhacayaan ama ilmuhu u soo dilmayaan way kala duwan yihiin laakiin waxa fudud in la daaweeyo midkan dambe ee 12 ilaa 24 week marka haweeneydu uurkeedu yahay dhacaya kan hore ee ilaa 12 weega ugu horeeya dhacaya iyo wixii ka horeeya waxa uu yahay mid markaasi daawadiisu adag tahay. Dr. Ahmed, you mentioned an important thing. Miscarriages that happen when the period is lost until 12 weeks are difficult to deal with. What are the reasons?
The reason why it's difficult because majority of these miscarriages as a result of congenital abnormality. The body is rejecting it. However, we cannot rely on that. We understand that in the health service, at the moment, the majority of people, when they start bleeding in early pregnancy, they are not looked after. The reason why, because they are under impression that the miscarriage happening as a result of majority of congenital malformation. However, in my case, I never ever submit to that. I.e., in a woman who is bleeding in early pregnancy, she must be seen, she must be examined, she must check the baby's heart by ultrasound and Doppler, she must have support to the pregnancy if the baby is viable and alive, she must have support, injectable or rectal suppositories, which is a hormonal support, i.e. the food the baby need to grow and survive, must be done. Okay. Unfortunately, that's not happening in most of the healthcare support.
Okay. Dr. Ahmed waxa uu leeyahay sababaha keena early miscarriageska amba in ilmuhu dilmaan waqti hore oo uu yiri waa 13 casho iyo wixii ka horeeya 12 usbuuc iyo wixii ka horeeya waxa ay yihiin macnaha jirka haweeneyda oo diidaya waxan soo galay ee ku dhex abuurmaya waxa uu leeyahay haweeneyda iyadu markaasi bleed gareynaysa ama uu dhiigu ka socdo kuna jirta waqtigii ugu horeeyay uurkeeda macna xiliyadiisii hore ku jirta waxa ay tahay in la siiyo hormonal support. If you could you mentioned that the woman who is bleeding, who is in the
she must be seen at once.
It must be seen at once.
At once.
Yeah.
There is no way.
Okay.
To be delayed and to go to the hospitals or to go to GPs and then they say, okay, come next week or come after 2 weeks, after 3 weeks, we don't have time, we cannot book you for a scan. That is all wrong.
Yes.
She must be seen, have a scan immediately.
Waa in la arkaa oo markaasi la baara ayuu leeyahay. Marka waxay tahay, you also talked about hormonal support.
Yes.
But the professionals need to make sure that the
baby is alive.
The baby is alive.
Exactly.
Yeah, definitely. Waa in marka hore la hubiyaa in cunuga ay xambaarsan tahay ay sidoo inuu caafimaad qaba kadibna marka la siiyaa hormonal support la siiyaa gargaar. And Dr. Ahmed, if I would like to ask you the miscarriages.
Yes, sir.
1 in every 6 pregnancies in this country.
20%.
Yeah, and 20% end in miscarriage. 1 in every 90 pregnancies in UK are ectopic.
1 in 300, that's correct.
1
in 300
are just 75%. These are statistics available of miscarriages happen in the first trimester. And I think this is what you're talking about. In the first 12 weeks of the pregnancy, 75 miscarriages that happen during that time. About 1 in every 100 women in UK experience recurrent miscarriages. Okay, so what I wanted to say is that if the 1 in every 6 women pregnancies end in miscarriage, if 1 in every 90 pregnancies are ectopic, so we are gathering this is a huge problem, but we can see the first trimester is more problematic than the second trimester, and
yes.
there are most of the miscarriages are taking place there.
Yes.
So what are the why not focus on the causes and
Let me just I'm so sorry to stop you for a second. A pregnant woman, it is natural. It's a nature. It's something happening everywhere in the world. It's not a science. It's not a disease. It is a nature continuity of the human being.
Yeah.
The continuity of the pregnancy depend on many factors. Number one, the health of the woman. The woman has to be healthy. You cannot give me a woman who's very, very weak. That's why I have people whom planning for a baby, I tell them, come along, let's give you a vitamin infusion. And the reason why I give them vitamin infusion, I'd like to see a healthy body in front of me planning for a baby. Or in early pregnancy. As soon as they're pregnant, I'd like them to have vitamin infusions. The reason why I just want to make sure that they are healthy body, to be able to cope with a newcomer. The pregnant woman becomes 2 people, not just one. Originally she's 1. Once she's pregnant, she becomes 2. 2 in everything. 2 in the emotions, 2 in the health, 2 in the food intake, 2 the vitamins intake. I'm not talking about food intake. That means woman has to eat for 2 people. No, that she has to eat a healthy food. That's a big difference between.
There is a twin pressure in everything.
That's right.
Yeah.
So that's number one regarding the woman's health. Number 2, woman should also be examined very early in pregnancy or before pregnancy, or if she is planning to get pregnant, to make sure that she is not carrying any disease which can intervene with the progress of pregnancy, like hypertension, high blood pressure, like diabetes, like thyroid problems, like endocrine problems, like bowel problems. All that can have, or infection somewhere in the body, all that can have an undesirable effect on the pregnancy. Number 3, if she's taking tablets, pills, smoking, shisha, cigarettes, whatever they call it, all that has got to stop and to be reduced before getting pregnant, or if she got pregnant, the woman has to stop all that unless it is life-saving medications given by practitioners.
Okay. walaalayaal sidaa la socotaan waxa uu dhakhtarku leeyahay uurka oo naajix noqda oo markaa uu haweeneydu uur yeelato sii socda ilaa meesha u dambaysa gaara oo cunug uu soo baxaa waxay ku xiran tahay caafimaadka haweeneyda. waxa ii yimaada dad buu leeyahay oo ayagu markaasi qorsheynaya inay awlaad helaan. waxaan sameeyaa waxaan siyaa leeyahay vitamin infusion iska hore uga hadalnay ayaan siinaa. maxaanan u siinaynaa ayuu yidhi si markaasi aan u akidno u hubinno in ay awood u leedahay haweeneydani in ay maaragtay qof naftan ku soo zaa'iday ee soo socota iyadoo ay xamlinayso oo jirkeedu uu xanaanaynayo oo wax kasta jirkeeda ka helaya ay u xamisho baahidiisa iyo culayskiisaba haweeneydu markay pregnant noqoto ama ay uur yeelato waxa ay noqotaa dhinac kasta laba nafle camal maaragtay iyada keliya maaha nafleyda kale ee ilaahay ku abuuray wadana waxaa culayskeedu yahay mid markaasi iyada saaran waxa daruuri ah Dr. Ahmed Ismail uu taabanayaa inay muhiim tahay dhammaanteena inteena badanaan ku dadaalnaa early exam baaris caafimaad oo degdega in hore laga sameeyo si loo hubiyo markaasi inayna jirin arrimo caafimaad darro ah waa in la hubiyaa inay diabetic ama macaanku oona jirin thyroidku ayna jirin waxa kale oo dhakhtarku ka digay haweeneyda uurka leh inay bad habits amba yeelato shiishe iyo sigaar iyo waxyaabo markaasi dhibaato u keeni kara ayada caafimaadkeedii caafimaadka noolaha kale ilaahay ku abuuray Dr. Ahmed, that was a good point. Known causes means it's very difficult to find out the exact causes of miscarriages. That is why is ongoing debate and research. But the known causes, which you have many times spoken about, which I hear from you, is that blood clotting means this happens normally when immune system produces or makes antibodies that attack the fats called phospholipids. And this makes the blood to become sticky, interferes with the flow of the blood in the placenta. Okay, what can you say about that?
I like what I'm hearing. You became very scientific.
I
like what
with
I'm
my
hearing.
association.
Thank you.
Can you please put this some light on
Women, when the pregnancy happens inside a uterus, the uterus, al-arham, al-rahim.
Yes.
Rahim, our uterus. How do you call it in Somali?
المجلانك.
المجلانك.
Yes.
If you look at the uterus, it is muscle, single muscles, and fed by blood vessels. And these blood vessels carry oxygen, vitamins, minerals, protein, carbohydrate. That is the contents of the stream of blood, which feed the baby. If that blood vessels are clotted or sclerosed or narrow or fibrosed from previous surgery, like previous cesarean sections or previous operation in the uterus, previous removal of the fibroid or myoma, all that can affect the flow of blood going to the baby. Therefore, just imagine having a baby inside a room, closed, and there is no oxygen. The baby would be suffocated and the baby will lose his life. Same with the baby inside the uterus.
Okay.
If you don't feed the baby with the oxygen, minerals, and vitamins, the baby will not grow, and the baby will stop growing. And that's why some of the women go to the doctor and say, oh, last time the baby's heart was good, this time there's no baby's heart, and the baby died in between the two visits. The reason for that, because the oxygen, minerals, vitamins supplying the baby were not good enough. Therefore, some of the patients, we identify them before pregnancy and give them some baby aspirin. And I'm sure lots of whoever women listening to me at the moment may have been subjected to baby aspirin during their pregnancy for two major reasons. One, to reduce the blood clotting of the blood vessels, i.e. to make the blood thin, also to reduce the possibility of
Yeah.
hypertension, and preeclampsia.
Definitely. Thank you very much, Dr. Ahmed. Daktarku waxa uu ka hadlay su-aal baan weydiiyey oo ku saabsaneed sababaha keeni kara in ilmuhu ay soo dilmaan. Waxaa ka mid a sababaha la ogyahay dhiigga oo xinjirooba. Waxaa jirku macnaha immune systemka amba nidaamka difaaca jirka ayaa waxa uu soo tuurayaa antibodies oo markaasi iyagu duulimaad ku qaado oo weerara fatiska ku jira jirka oo la yidhaha phospholipids. Marka taasi markay dhacdo fatiska ilaahay wuxuu ugu talagalay inay dhiigga ka dhigaan mid qulqula. Marka waxaa dhacaysa in dhiiggu uu xarkago. taasina sida dhakhtarka noo sheegay waxay keenaysaa in waxyaabihii nafaqadii iyo mineralskii ay gaari waayaan macnaha noolaha haweeneydu ay wado cunuga inay gaari waayaan. waxaa dhacaysa that the macnaha you mentioned the uterus is a single muscle and when clotting happens the vessel is clotted, narrowed, and the flow of important vitamins, minerals, and oxygen is blocked. The baby suffers or dies. So, marka dhakhtarku wuxuu leeyahay marka taasi dhacdo socodkii dhiigga qulqilkii iyo waxyaabihii nafaqooyinkii la doonayay inay gaaraan babyga ama cunuga inay gaaraan ayaa wuxuu noqonayaa mid xanibma waayo dhiiggii baa xarkagay amba meeshii baa ayadoo qaliimo hore iyo operationno hore ayaa noqonaysa mid markaasi dhuuban amba aanan waasic ahayn. marka waxaa jiroo yidhi haween uur leh oo la siiyo baby aspirinka oo markaasi sahlaya in maaragtay dhiiggaasi meeshaasi ayna xirmin uu fududaado. Dr. Ahmed, abnormal cervical weaknesses is also considered to be a problem. Some women have their cervixes are too weak, so it is also a reason for the miscarriage.
Yes.
Can you explain this to us?
Generally speaking, majority of women who has weak cervix, they usually after having babies. Traumatic babies, traumatic deliveries, traumatic way of delivery, i.e. women who's asked to push before the cervix is fully dilated, open enough for the baby's head to come out or the bottom to come out. That can be a cause of weakness of the cervix. Secondly, when there is a tear of the cervix is cut during the delivery. There is also patients who has congenital abnormality of weakness of the cervix. Majority of these two groups of patients do have miscarriages after 12 weeks.
Okay.
Or around 12 weeks.
Okay.
Could be 18 weeks, could be 16 weeks, could be 11 weeks, still around 12 weeks. Could be 19 weeks, could be 22 weeks, 23 weeks, could be premature labor. All that is as a result of weakness of the cervix. And the women who heard me now, they may have had a chance to remember when they went to the doctors and the doctors took them to the hospital. The hospital said, we must put a stitch around the cervix to close it between 11 to 12 weeks. And that is the way how to survive the pregnancy until term, and before the baby is delivered, we cut the stitch again.
Yes. intii aanan u sii gelin waxaa khadka telefoonka ku jira walaalo doonaya inay barnaamijka ka qayb qaataan. waan soo dhawaynaynaa walaal qofkii khadka ku jira ku soo dhawow khadka telefoonka.
السلام عليكم ورحمة الله. هلو.
walaal codkaaga kor u qaad.
هاي السلام عليكم ورحمة والله.
عليكم السلام ورحمة الله ولا سودوا وبرنامجكي عافيماتك وحمرت نوغا سال سعودي دكتور أحمد إسماعيل خبير إساقو كو تخصص عرضة هوينك.
ها والله المهد سند والله الحرة بالسؤال إنا ويديو دكتورك.
أيه.
إنجليش هل ما كلها هاد الكرا إنجليش بنكو هاد لسه يعني.
سواء يا واد يفوض دينيسا خير الله كسي.
هاي والله.
مقعاقي ماشا كسو هاد ليس ولا.
والله ليلى وحن كسو هاد لي إدمنتون.
Yes, Leila from Edmonton would like to put her question across to you in English.
Sure, Laila.
Welcome.
Welcome.
Hi, hola,
Carry
Leila.
on. Ask your question, Laila.
Leila. waxaan soo dhaweynaynaa walaasheen Leila. ku soo dhawaaw qadka telefoonka walaal.
Hello.
walaal ku soo dhawaaw.
waa ku soo dhawaay walaal maanta waa interview laga qaaday oo dhinaca badda.
walaal waxaan ka hadlaynaa barnaamijka caafimaadka haweenka wuxuu ku saabsan yahay cudurrada haweenka walaal. Okay, I think the second cause of late miscarriage is the issue we are now discussing, the cervical weakness. We know that the cervix or the front part of the uterus opens up for the wideness, for the baby to come out. So if it is too weak, it means that the baby would come out sooner, isn't it?
Exactly.
And then you mentioned it. A standard way to help is to
put a stitch called Shirotker sutures or McDonald suture.
Okay, saa maqlaysaan wuxuu dhakhtarku ka hadlay sababta labaad ee keeni karta ilmuhu inay dilmaan waxayna tahay dhuunta ama afka ilmagaleenka oo haweenka qaar ay tahay mid markaasi jilicsan. Marka waana ognahay in maaragtay cervixku uu yahay macnaha ilmagaleenka afkiisa hore oo iyadu furanta oo waasic noqota si cunugu u dhasho. Marka haweenaydani cervixkeeda ama dhuunta ilmagaleentu ay tahay mid jilicsan waxay noqonaysaa inay furanto waqtigeedii oo la gaarin oo ilmuhu ay ka soo dhacaan meeshaasi ay noqoto miscarriage ama dhicis. dhakhtarku wuxuu leeyahay iyadana waxa lagaga hortagaa stitch baan sameynaa oo lagu magacaabo which is called
Shirotker suture or McDonald.
Marka, I would like just to make good use of the knowledge Allah gave you and the one you have worked very hard. We have covered abnormal shaped uterus is regarded as also a huge problem.
Very good.
Can you tell us?
There is people born with some abnormality within the uterus.
Yes.
Something called bicornate uterus or الرحم ذو القرنين, if the people speak Arabic, which basically the shape like that. If I make a drawing, the shape of the uterus like that. This is called bicornate uterus, like shape of the heart. Different than the shape of the normal uterus. The normal uterus is like that. That's a normal shaped uterus, and that is a bicornate uterus. Okay. Sometimes the bicornate uterus becomes divided completely and called uterine didelphus. The woman say, I went to the doctors told me that you have double uterus, two uterus. Sometimes they have a uterus which is normal and the other half called rudimentary, i.e. totally fibrosed and abnormal.
So the one of the main reason is the abnormal shaped uterus. I think uterus that you explain it, which Dhul Qarnayn means it has two holes.
Bicornuate.
Yeah, definitely.
Bicornuate.
Yeah, definitely. And the one that is normal. I think the other thing I would like to say is some people are born with they have abnormal uterus, which looks like half of.
That's what I just mentioned.
That is half of it.
Yes, which is.
Okay.
Yeah.
khadka telefoonka qof baa ku jira, walaal ku soo dhawaaw.
hallo waxaa la yidhahaa Fartuun Muuse.
Fartuun, walaal codkaaga wax yar sare u qaad adoo raaliya.
walaal waxaa la yidhahaa Fartuun Muuse, ma maqlaysaa hadda?
Fartuun, ku soo dhawaa barnaamijka.
walaal waan ku dhowahay, waxaan ku noolaa wadanka Norway.
Haye walaal.
waxaan rabay walaal dhakhtarka inaan weydiiyo, ilma iga soo dilmay dhowr mar. dhakhtarkii marka u tago markuu ibaarana wuxuu leeyahay waxaa qabtid ma lahan. uurka markaa qaadana ilmaha way iga 3 bil 4 bil 2 bil 3 mar ay iga soo halaabeen, saasay iga soo halaabeen, maxaa keeni karo?
meeqa jeer ay kaa soo halaabeen walaal?
3 mar walaal, oo mar 4 bil marna 3 bil marna 2 bil ahaa.
Okay. waa mahadsan tahay walaasheen Fartuun. Fartuun is a sister calling from Norway. She said, I have lots of miscarriages. I went to a doctor. Doctor said you had no problem. And I lost my pregnancies 3 times when it was 4 months, 3 months, and 2 months.
4 months, that means 18 weeks, most likely due to cervical problem. 3 months is 14 weeks, most likely it is due to cervical problem. 2 months, which if it is the 3rd pregnancy, I would like to know, is the last pregnancy the 2 months?
The 2 months, yes.
The last pregnancy.
I think she gave me 4, 3, and 2, yes.
Right. So most likely this lady, she might need a Shirokar suture in around 11 to 12 weeks in her early pregnancy.
dhakhtarkaas sida uu ku sheegay waxa uu leeyahay ilmaha ka soo dilmay 4 bilood iyo 3 bilood kaaga soo dilmay waxa aad muxtamal u ah ay u badan tahay inay tahay iyada uguna wacan tahay cervical problem amba mashaakil ka jira arrinkii hadda aan ka hadlaynay afka hore ilma galeenka oo aanan markaasi weak amba aan awood lahayn. marka waxaad u baahan tahay uu yiri in la xiro oo processkii hadda uu ka hadlay taasoo ay tahay in la sameeyo. marka uurkaagu uu yahay 11 ilaa 12 usbuuca 11 ilaa kan iyo 12. marka walaal la soo xiriir professional advice waxaan ka qaado telefonkiisana waxaad ka helaysaa Kalsan TV ama hadda studio hadda soo wacday mar labaad aad soo wacdo. Okay. The other thing I wanted to ask you, infections
Yes.
and uncontrolled diabetes or untreated thyroids. The very thing you started with our discussion is that the person has to be healthy.
Exactly.
Yeah, only healthy bodies can carry healthy babies.
Precisely.
While I'm not a professional like yourself, I would like you to tell us.
I just wanted to make sure that the people understand.
Yes.
When they are referring that people are in the middle of the desert, have a babies and so on, they don't realize how many babies are lost in the desert. How many women have died during deliveries in the desert. How many women had miscarriages in the desert. So let us talk in the more scientific way. Let's be more specific. We look after people. We work very hard. We do our research to make sure that women are looked after properly before getting pregnant. Or if they got pregnant in early pregnancy, they have to be looked after, test their blood, find out if there's any infection which can cause damage to the baby, like rubella, German measles, like toxoplasmosis, like cytomegalovirus, like bacteria down below, like fungus down below. All these infections has direct toxic effect on the baby. And that can have an undesirable effect, whether it is during the development of the organs of the baby, leaving baby with some congenital abnormalities or being handicapped, or sometimes they lose the pregnancy altogether. Therefore, early pre-conception examination is very important for both. By the way,
Pre-conception,
it's not only for the woman and the man.
Yes.
The man must also understand he is half of that baby.
Okay, I think so pre-conception and during the pregnancy checks are what you always highlight and what seems to be necessary to spot if there are underlying health factors. Okay, let's go to the second part. You never get enough of your lectures and your explanations. The menopause is when the period stops and ovaries lose their reproductive functions. This is also another problem. When you look at the menopause, the average age the woman go through the menopause is, as you might agree, 52. Could start it between the ages of 45 and 55. Symptoms may last for 5 years. Medical conditions can cause the menopause to happen much earlier. Sometimes we have menopause, as you mentioned it to us, in women as young as 20.
Yes.
Before you give us your good explanation on the subject, there is somebody on the phone. Walal soo dhawow, khadka ku soo dhawow.
waa dhawa walaal salaamu calaykum.
Calaykum assalaam. Magacaagii meesha ka soo hadlaysa walaal adoo raaliya.
walaal nimco faarax baa la dhahaa sarmarkan kasoo kaasoo waqaya.
Nimco, su-aashaada u soo gudbi daktarka Ahmed.
walaalo waxaan rabaa inaan weydiiyo doctorka dhiigga aad ugu xanuunsadaa marka ugu dhaco.
Okay.
ilaa aan mataqaanaa wax xanuun baabi'iya isticmaalo mooyaane xanuunkaas ima daayo oo aad ilaa aan emergency taga mooyaan oo dhakhtar aan aado marka dhakhtarka ibaaraana waxba kuma hayaan ay leeyihiin.
Okay. wax kale aad weydiinayso?
maya intaasaan weydiin lahaa.
Okay, the sister Nimca is calling from Germany. She said, I experience severe pain when I have my periods. I go to doctor, they don't tell me anything.
Can you tell me, my sister, assalamu alaikum, can you tell me, is the pain happening before the period or from the first day of the period?
Okay, walaasha khadka kuma jirtaan moodaya ma ku jirtaa khadka walaal waa maqlaysaa. waxa uu ku weydiiyey ma xanuunku wuxuu dhacayaa before the period or
with the onset of the period?
ama markii ay caadadu socoto.
markuu saa igu dhacaba waan xanuunsanaya markuu iga dhamaadana waan fiicnaanaya.
I experience the pain when it starts.
Excellent.
And when it finishes, I have no pain at all. Imise jir baa tahay adoo raaliya?
23.
I mean, it's 23 years of age.
And she's married?
And ma leedahay oday ma leedahay ma lagu qabaa haweeney la qaba maata? Yes.
Are you planning for a baby?
Ma qorsheynaysaa inaad ubad yeelato?
waan rabaa.
Yes, I wish.
Well, two things. If you are planning for a baby, we have to get you pregnant very quickly. If you are not planning for a baby, we'll put you on contraceptive pills. By the way, my sister, the pain in the first day of the period usually associated with some changes in your breast getting bigger before a few days before the period. You feel a little bit of back pain. This is a good news. That means you have been ovulating, and that is a good news. However, we don't like pain, obviously. Paracetamol and aspirin can help.
It doesn't help, she said.
If it doesn't help, that means we may have, if it is severe, we may have to dilate the cervix. The cervix.
What does that mean?
The cervix or the neck of the womb could be very tight. And if it is very, very tight, can cause
Pain.
severe pain.
Okay.
So we dilate the cervix with something like a pen called dilators under either local anesthetic or general anesthetic, and go inside with a little camera, look inside the cavity of the uterus, make sure that the cavity is okay, dilate the cervix to probably Hagar 10, i.e. 10 size dilators, and you'll feel much better afterwards. And the sooner as you get pregnant, the sooner you get pregnant is the better.
dhakhtarka wuxuu ku leeyahay caadada imaanaysa waa wax fiican laakiin qof doonaya inuu xanuun uu hayo ma jirto marka waan u sheegay in haddii aad isticmaasho pain killerska xataa aynan markaa xal kuu noqonin marka wuxuu ku yiri the recommended standard treatment to relieve of this problem is to dilate.
No. It's not a standard. This is when you have tried all the anti-inflammatory pain relief, like, for example, ibuprofen, like paracetamol.
All painkillers.
All the painkillers.
After it fails.
But not narcotic painkillers. Painkillers.
Okay.
Not narcotic.
Okay.
But then after it fails, we have to do a hysteroscopy
Yes.
and dilatation of the cervix to the point that it reach about 10 dilated size 10 or size 12,
Okay.
and that will ease on the future pain.
Okay. I think waqtiga ayaa nagu yar mana noo suurtagelayso inaan barnaamijka sii wadno waxay la tahay mawduuceena menopause-ka mustaqbalka ayaan ka hadlaynaa qof baa khadka telefoonka ku jira soo dhawaa walaal
assalaamu calaykum
calaykum assalaam waraxmatullah
walaal waxaan rabaa dhakhtarka inaad muxuu hayaan wax su'aalo afka ma aqaan laakiin adaa iga turjumaya
hay magacaagii meesha ka soo hadlaysa walaal
waxaan ka soo hadlayaa baanad magacaygana waxa la yiraahdaa shukri
inta ka soo hadlaysa baanad haye magacaagana maxaa tiri walaal
shukri baa la yidhahaa walaal
shukri haye walaal su'aashaada soo gudbi adoo iga raaliya dhaqso
walaal waxaan rabaa gabadhayda baa waxa laba jeer waxa ka dilmay ilmo
haye
2010kii and 2013kii uur damena ma yeelan waxaan rabaa marka dhakhtarkaada inaad ii weydiiso waxa koosgareynaya ilaahay baa garanaya
Okay, the sister is calling from London and she said, my daughter had 2 miscarriages, one in 2010 and another in 2013. All I know is what are causing these miscarriages. I wanted his answer.
Does she have children?
Arur may leedahay walaal. Just we lost her. I think it's a general. I think what is your advice? We have brief information.
She should be examined.
Yes.
She should be checked. We should find out exactly the proper history. Once we take the proper history, proper examination, appropriate investigation, we'll be able to identify the problem and treat correctly.
Okay. walaashana soo weydiisay gabadheedu hadlaysay waa in marka hore la baaro marka aan helno taariikhdeeda caafimaad aan baarno ayaa markaasi ayaan daweyn karnaa iyo dhakhtarka leeyahay marka fadlan la soo xiriir taleefanka dhakhtarka waxa ka helaysaa stuudiyaha qof baa khadka ku jira walaal ku soo dhawaaw
Hello
walaal magacaagii meesha ka soo hadlayso su'aashaadana dhaqso u soo gudbi walaal
Okay, walaal assalaamu calaykum magacayga Xalimo waa London ka soo wacaya
Xalimo ku soo dhawo Xalimo
waxaan weydiinayaa dhakhtarka ovarian reserve-ka hadda menopause-kood ka hadlayseen anigu age-ka 30 ka yarahay 29 jira maxaa la dhahaa dhakhtar badan baan u tagay marka waxay igu dhaheen ukumahaaga yar ur ma qaadi kartin badan baa reer lahaa marka hadda waxaan sameeyay IVF baan sameeyay marka waxay igu dhaheen ur caadi uma qaadi kartid marka inuu wax iga siin lahaa advice ani maxaa la dhahaa marka wuxuu ovarian reserve baad qabtaa bay igu dhaheen ukumahaaga aad u yar yar
Okay, the sister is referring to the later topic of the menopause. I mean, she's talking. She talked about. She went to a doctor, and she was told that the ovaries are not releasing enough eggs. The stock of the ovaries has decreased. So she has undertaken IVF. So she wants more explanation on this.
How old is she?
imise jir baa tahay walaal haddaana maqlaysid weli 29 years.
Oh, she's very young. Well, basically, at age of 29, it is must be a reason for the decline of the AMH or the ovarian reserve, and also must be a reason of why she's not producing enough eggs. Once we correct the reason, we'll be able to produce better number of eggs. IVF is not the good answer without identifying the problems to be able to have the better success rate even if you go to an IVF.
Yes. And marka waxaan u malaynayaa qof kale ku jira khadka telefoonka in kastoon jecelnahay inaan barnaamijka dad badan fursad u siino waxaa la soo gaaray gebagabadii waxaan rajaynaynaa in aan mustaqbalka ka sii wadi doono doodaheena la xiriira caafimaadka haweenka waxaan ilaahay uga mahad celinayaa in aan macnaha ka faa'iidaysanay waqtigeena oo aan ku qaadanay si maaragtay faa'iido u leh mujtamaca waxaan mahad u celinayaa dhakhtarka Ahmed Ismail oo asagoo khabiir ku takhasusay cudurrada haweenka oo noo cadaynayay noona sharxayay labadan arrimood. Doctor, we have to thank God, and it's a Eid Mubarak to you and the rest of the people who are viewing us. I think we thank you for coming to Kalsan TV.
Thank you, sir.
And I hope that people who want to get in touch with you would be able through the TV and come and visit you and discuss their issues with you privately in their own times.
Always my pleasure.
So thank you for coming.
Thank you, sir.
Two big topics.
Thank you.
And the time is not enough to cover, but we look forward to see you in the near future.
Thank you.
Thank you so much.
Thank you, sir, very much. Thank you.
Thanks.